Hundreds of thousands of Texans lost their health insurance in the last 3 months. It comes after the federal government ended pandemic-era protections to keep people from being removed from Medicaid. But as Ryan Chandler reports, thousands of sick, pregnant, and elderly people may have lost their coverage by mistake.
Overworked and underprepared. Employees inside Texas's Health and Human Services Commission say the agency is facing a crisis of care and making matters worse. They write in this email shared with Nexstar, the agency is facing significant risks, including the potential termination of Medicaid coverage for countless individuals and the potential loss of billions of dollars in federal funding. They say 80,000 individuals lost coverage erroneously, including several thousand pregnant women who required critical services. Concerned employees say understaffing, outdated technology, and disheartening leadership set them up to fail at the daunting task of reviewing 6 million Medicaid recipients. And now some lawmakers are saying Texas dropped the ball.
This is something the state should have been better prepared for. I want to emphasize, I don't want to pick on anyone at the agency. I know we're in the crisis. They're all working overtime, working really hard right now. They're trying to make up for a deficiency in resources and a past deficiency in hiring. But this is not the federal government's fault. This is our fault.
We are aware of some Medicaid cases that were denied improperly, the agency told us, and we're working to reinstate coverage for those individuals as soon as possible. Senator Johnson argues the long-term solution lies in the legislature, blaming budget writers for shortchanging the agency's budget.
It's alarming, and it shouldn't have happened, and it's the result, frankly, of poor planning and execution by the state.
Ryan Chandler, KXAN News.
HHSC tells us they offer the concerned employees an opportunity to work through their concerns, explaining this is, quote, a massive undertaking. To give you a little perspective about Medicaid in Texas, this isn't the only problem we've reported in recent weeks. Back in June, we told you about the federal policy changes targeting the state's funding model that could gut almost $9 billion from the state's Medicaid system. The Kaiser Family Foundation reports nearly 6 million Texans are enrolled in Medicaid. And it also found nearly half of all births in the state were covered by Medicaid.